Physicians are at a crucial fork in the road. You can choose the path that you've been on for the past 20 years, or you can choose a new route. Just to the right is the J.M. Woodworth Risk Retention Group, a physician-owned, A-rated medical malpractice insurance program that will not only save you money, but give you the protection you need. So let's change direction and take that fork in the road.
Hi, I'm Skip Pleninger, co-founder of the J.M. Woodworth Risk Retention Group. The fork in the road for physicians is here in New York State. In developing J.M. Woodworth, we wanted to provide the best possible solution to affordable medical malpractice insurance, to be different than other malpractice carriers who are struggling. The Risk Retention Group model does just that. Physicians joining physicians, funding and guiding their own company to reduce risk and premiums. Physicians helping physicians control their malpractice environment. Let's see what a few of your colleagues have to say about J.M. Woodworth.
So I've always thought that just like when you buy health insurance, if you're very healthy and you don't smoke and you have a healthy lifestyle, you should pay a lesser premium. The RRG company came to me and said, that's exactly what we do. So I'm pleased to be part of it. I'm honored that they would select me because it's always been important to me.
Prior to this, there were no other options, and we all felt like we were victims of the medical malpractice problem. And this really was the first time we were able to make a choice.
J.M. Woodworth's policyholders are insureds and shareholders. Selective underwriting allows us to enroll physicians who operate low-risk practices. J.M. Woodworth is A-rated for financial stability and backed by A-rated reinsurance. This means your coverage and investment are secure.
Well, being a charter member of this particular RRG has given us the opportunity for direct involvement in the process, and even actually in the policy form itself.
The idea that the RRG is physician-owned has been something that we've looked forward to, so the physicians feel like they have a stake in the company.
Premiums for traditional medical malpractice have gone up at unprecedented levels. This trend is expected to continue. On the legislative side, the governor has a task force looking into the more than $1.9 billion deficit. Rate increases of 15% to 25% a year for the next 5 years have been suggested. Additional assessments are in the works to help bail out this broken system. When is it going to end? The day you join J.M. Woodworth. J.M. Woodworth's premiums are substantially less due to aggressive underwriting, strong risk management, and a duty to defend all claims.
Well, looking at 14% increases like they're going to do this year, and looking at this maybe $50,000 assessment they're going to put on us, out of the blue comes this opportunity to have a new carrier that's going to charge me far less money. So that was quite surprising. I didn't expect it. I didn't know it was out there. What that does for me is help me to plan for my retire. I have 7 to 10 more years before I retire. The savings that they're going to offer me over that time means I'll probably be able to retire sooner. That's a tremendous comfort. That's what I think of the most at this stage of my career.
We were able to take the savings from our previous malpractice premiums and apply those directly to help fund our EMR program.
Think of it this way. You give your patients advice every day on how to change their future. A better diet, an exercise program, even to quit smoking. This is your chance to take your own advice. Join the J.M. Woodworth Risk Retention Group to protect your practice and avoid disaster down the road. Complete an application today to confirm that you are eligible for our program and to see how much money your practice can save.
All physicians should take a look at this because they're looking at all risk groups. Some of us have more risk inherent in our practice than others. This RRG is going to look at each individual doctor within his specialty and look at his individual risk. If they choose you, you should be honored because you're going to have a real company backing you up and you're going to pay far less money. And again, like the insurance company that rewards you for not smoking and a healthy lifestyle, they're going to reward you finally for a clean slate in the malpractice world. I know of no other insurance company that's going to do that for me.
Well, why do you get a quote for any new product? You get a quote to see how it compares to where you are now. So you should get a policy quote just as a starting point towards what should be a very diligent process, a very diligent, organized process towards making a good business decision for your company.
It's just a click or a phone call away. Get in touch with us now and take that fork in the road to a better future.